others can join in. First of all, let me welcome all the participants to this workshop, which we will be holding from time to time. So, EPLMF Memorial Fund, besides just giving support for students, financial support, educational support, bursary, and others, we are also involved in promoting interest in the area of social work training and social work enhancements of social work skills. Basically, we diversified. Besides just giving scholarship and bursaries, we also get into areas of promoting training for people in the region. So we started what you call the social service leadership training in the Asian Pacific, ASEAN region, basically. And we hope that we will be able to bring in young social service leaders, those who are working in social service sector, to come together to share the challenges. So this is one new area that we have embarked, and we have conducted, for your information, about so far three workshops. I think we are going to 4, but COVID hit us, so we with travel restrictions and other things, we have decided not to we were unable to carry this program out for this year, but we are still in place to think about how to get it through the when things are when what do you call good times return. And the next area that we go into is the social service impact. We have social service impact award, where we are trying to encourage organizations and workers in the region besides Singapore to be able to submit the most innovative project that they think they have in the area of human service or social service, social work intervention, and various community work, social enterprises, and all that. So we have an award which carries some money, and we hope that this could be seed money for subsequent activities that they want to conduct. So this is the Social Service Impact Award. So this has been conducted, but because of COVID and other related issues, it's been stalled for the time being. And then from time to time, we run workshops, bringing in people from different places to come in to give seminars. So you can hear more of us in due course to run some of these workshops that we have. And we will try our best to see how we can mount some of this in the interest of the social service, social work community. So I'd like to thank all of you for taking time to attend this. But before I do, let me introduce Ong Bee Yong to all of you. Bee Yong, I think some of you would know, but she is one of those who graduated, I think, in the early 90s. And a very enterprising person who has worked in the MHA, I think, home team. And then she has worked in the social service arena. But most of her work is in the area of working with refugees, working with crises, working with migrants and other related problems. And Crisis Alliance is one of the organizations she, together with a group of friends, felt necessary to initiate. And as you know, the region has got a lot of crises now and then. You name it, you have it, you know. You have landslides, you have volcanic eruption, and then you have terrorist attack, you have all sorts of things. You have warfare, you have different fights between ethnic groups, and this leads to atrocities and various other problems, other crises. So crisis all over. So therefore, Crisis Alliance is probably born out of some of these perspective or these events and all that influence a group of friends like Bee Yong and her friends to come together to set up an organization called Crisis Alliance, right?
Relief Alliance.
Relief, huh? Okay. I think that's very important.
CRA.
Yeah. GRA. Okay.
CC.
GRC, lah.
CRA.
CRA, yeah. Crisis Relief Alliance. CRA. Yeah. Not clinical research assistant, no, CRA. That's what I'm.
Maybe one day.
Okay. Beyong has been involved in this crisis alliance for some time. She worked in Afghanistan and also some of the areas like Indonesia, with all the tsunami and other related problems. She has got a group and others that are involved in this organization has got that experience. And she brings a interventionist perspective to the work in dealing with crisis of workers today. And as you know, we have had this crisis, COVID crisis, that affected a lot of dormitories around. We have almost close to about 250,000 migrant workers living in the different dormitories. And some of these are all affected, as you all know. Most of our COVID infections in the dormitory, understandable because it's a very highly dense area, closely knit, and then people live together in small spaces. So if one gets infected, all the transmission gets ongoing. So, so there is a crisis in some of these dorms, and there is a lot of setback because there are a lot of issues, mental health, health issues, not going to work, not being able to interact, and to be able to go to Little India, to go to different places, Gelang Serai, and all other places that are quite familiar for these workers. So life becomes quite isolated for some of them, and that can be quite trying, as you all would appreciate. If we are left in confined space for a long time without any interaction, with only the same faces, same people, we end up fighting with one another. After a while, we see each other, and then after that we become enemies. We become unfriendly. We start being friendly. After that, you have difficulty. So she's been working in that area, and hopefully, as a result of her work, I hope she can publish some areas of looking at social work intervention work, social interventions in working workers in the dormitories, and then inspire other people who are interested to work with these people there. And as I've said earlier, there is inadequate services in that area. So this is an area where I think NGOs particularly, because you're free to decide, and then if you are set up on the basis to work with foreign workers, domestic workers, migrant workers, you have the mandate, but their organizations can also develop service areas in this direction. So we'll have to hear her out in terms of your work, and her area today, as you all know, is the work with workers, the social psychological issues that are faced by all these workers in the dormitories. And what are the issues? How can they be helped? What are the critical things that workers can do? And how can they be enabled to manage their life in a most effective way despite limited resources. So Bee Yong, maybe you take over. From now on, you have about 30 minutes, Bee Yong.
Okay. Okay.
30, 30, 35. Then we will open for discussions. The thing is this, I hope you all, your job is to try and raise some questions for her to address. And a seminar will not be complete without you people participating. Okay, don't remain virtual, you must be interactive. Okay, Bee Yong, carry on.
Hi. Hello, good afternoon. Thank you. Thank you, everyone, for sacrificing your 1 hour to be with us. My name is Bee Yong. I married a doctor, a medical doctor, and who's also the classmate of Dr. Vasoo's daughter. So we realize the world is quite small. First, I want to thank Dr. Vasoo for this opportunity and his ever ready support to me from EPLMF Memorial Fund. Yeah, and I would like to share screen. Uh,
Besides, before you go, Bee Yong, I just let
yeah.
them know. I let the participants know that Bee Yong is at the moment doing her master's in public health at Hopkins University.
Yeah.
So John Hopkins, it provides not only healthcare but all other related programs, but mainly on health-related public health issues and medical sort of work. So she is enrolled as a postgraduate student there. Hopefully, she will graduate from there and share her ideas with us. Okay, Bee Yong, carry on.
Okay. I thought hopefully I graduate.
Very soon you'll be graduating.
Yeah, it is a master's of applied science in humanitarian health, set up under the Johns Hopkins Humanitarian Center under Bloomberg School of Public Health. So I'm so glad to have the opportunity to be part of that school, entering into our second year in a few days' time. Yeah. So today, what I'm sharing is just from my perspective, and I know many of you have been doing migrant work many more years. They have so much more experience than me. So this is but a little sharing. So please contribute your ideas, and we can all learn together in this journey. Yeah. So that's me. Okay. Yeah. So before before we move on, I do have some questions, but since I can't see you, you can see me. Maybe some questions that we can reflect on before we talked about crisis work. What are some changes that you've noticed in yourself in the past 6 months personally? For example, in BPSS, in biologically, what kind of changes have you discovered in yourself? Do you feel tired easily? Or do you feel more energetic? Because it seems like half of Singapore have taken on jogging recently. Because when I go to Park Connector, it's always full now. It was never in the past pre-COVID. Or do you experience more pains and aches? I do. I think it's about age. It's my age. I'm hitting 50 soon. Yeah. So psychologically, what have you noticed about yourself? Do you get more emotional? Do you get tearful easily, irritable? Do you feel highs and lows and for no reason? And connectively, do you feel that you are mentally more alert because you sleep in more? You do not have to travel to work? Or you feel you're over functioning just because now everything is virtual? There's no clear cutoff of your working hours? Or do you feel that you're overthinking lately? Or do you find it hard to concentrate? Socially, do you feel FOMO, you fear of missing out because you're not out there with your friends? You may not be able to catch up with their life. Or are you glad for the space that it provides you now because you don't feel that you have to meet people? Because social distancing is a good enough reason to keep home. Yeah. On relationship wise, do you feel that last 6 months some relationships were strengthened, but others were strained because you have to live together within the same household? Yeah. Spiritual wise, I wonder if you have more time for spiritual things and more questions raised about meaning of life or life issues. Or do you have other concerns of safety concerns and risk concerns? Have you been abused verbally, emotionally, psychologically because you are not able to be out of the house to get a breather and because everyone is living together? Or are there concerns of self-harm or risk-taking behaviors? I ask this because I know many of us are practitioners in different fields. And I say that with a lot of pain in my heart too, because 2 months ago, a social worker took her life. And it was very hard for me. It was very hard. I do not know her, but I got to know someone who knows her personally, and I walked through that journey. And I walked past my flat, my own flat. I went to get breakfast, and I was coming back from my flat, and I saw a body on the ground. A boy committed suicide, came to my block to jump, and it happens that he is my friend's classmate, my daughter's classmate, and my friend's son. So doing migrant work has impacted me in many ways because we also hear of migrant workers committing suicide or threatening suicide, as you have read in a newspaper or watch on YouTube on them standing at the ledge. And I know you probably have different reactions or different things run through your mind. But I think what they are going through, we all go through as a human being. And today we want to share, to provide space to share our humanness, that we, we, we all go through COVID and it's not easy. And for some group of people, the difficulties are compounded because of the situations or because of their working environment. Yeah. So a brief history of CRA, we started in 2016. And prior to that, I was already involved in crisis relief work in two other organizations. And I helped to start one organization before CRA. And we have the privilege to work with healthcare founder, Dr. Goh Wee Leong. Together, we were serving in one other crisis work ministry before. So we started in 2006 formally as an organization, but we met way before that to formalize this organization and to get the lawyers in to write constitutions and to get accountants in to start to work on all the proper safeguards for the organization. Yeah. So it started by a group of us, and many of the team members are medical doctors. We have nurses, and we have different ones in other fields. But when it started, I was the only social worker. So regarding COVID, we might have heard of cases in November. So today's presentation, we're talking about the 3 phases that pertaining to Singapore. Yeah, so it was a pre-impact. The impact had started in other countries, but for us was pre-impact in November. And then in our course in Johns Hopkins, we were really talking about when would the PHEIC be called? Because in Johns Hopkins, our lecturers are all practitioners, and some of them sit in WHO, some sit in UNHCR. UNHCR stands for the humanitarian branch of UN work, where they look at the work of refugee camps. Yeah. So on 23rd January, we had our first case of COVID in Singapore. And if you remember, 2 days after was CNY for the Chinese. And there were some concerns. And this probably was a talk during your Chinese New Year visitation. But it was still a pre-impact. We knew something was happening, but we haven't felt the impact of it. On the 31st, PHEIC was declared by WHO. So PHEIC was only came about after SARS. After SARS, they realized that what can WHO do as a WHO and go about bringing about international effort to handle SARS. And they decided that they should come up with a declaration called the Public Health Emergency of International Concern. So this concern, this PHEIC was declared 5 times in the past, but we probably do not hear much because we are in Asia, and Ebola, Zika, polio, Ebola again, and H1N1 were not were not of concern, of so much concern in this part of Singapore. Yeah, so Ebola was declared twice because of 2 different outbreaks. So it's over 2009 to 2019 that the 5 declarations were made. So you can read up if you're interested in PHEIC, because I think it's something that we should be concerned, and that Singapore is part of. We have signed up to be part of this PHEIC a member, whereby there's certain protocol that they have to keep to, and how they would go about reporting cases, and how to work together, and how to even work together to help countries that are have less resources during this period of handling of this pandemic. So in February, CRA was challenged to see if we would like to play a role in helping out with COVID. And we started with producing short little video clips from the medical doctors and nurses who are in the hospitals and GP setting. So we wanted to encourage the healthcare workers in their work. And that we didn't start with some big plans. We just started with videos, and then the COVID cases started. We get to hear more cases in February, and mid-February onwards, we started thinking maybe there's a need for a counseling hotline, and we launched it on the 20th March, and it was a lot of planning involved, because we did not want to provide a hotline meant by volunteers with a good heart wanting to provide listening ear. We wanted to come out as a professional, with a professional platform, and we round up social workers, so friends from classmates in NUS days all the way. We had to speak to different ones, because we wanted to start the hotline from 9 a.m. to 9 p.m. As I'm speaking now, the hotline is still running. So we run it every day since then, from 20th March. We run 12 hours a day, split over 3 shifts. So as I speak, if it touches your eye and resonate with you, and you would like to volunteer with us in the hotline, we can have a chat. You can give me a private message. We take in counselors, social workers with at least 6 years of direct work, and we provide you the training, the framework, and yeah. So starting this hotline was quite pivotal to our work, because then we started receiving calls, and the nature of call, yeah, is varied, and we also have workers calling in because they're overworked. They are super overworked, because even on the off days, they are receiving calls and all that. So there wasn't a clear line. And while many people are beginning to be concerned and starting to work from home, our essential services like the hospitals are still running 24/7. And CRA decided that on the 8th April, we were asked by MOM if we would like to be involved in doing needs assessment. And by then we have really put together a team of doctors, and we said yes, but we didn't know what we are in for. Because they only gave us 4 dormitories. We say, doable. And I went in with them because it was only 4, and it is important that that if I'm running a hotline, I also know what's happening on the ground in terms of COVID situations in the community. So I started going in with doctors, and we went to dormitories. So we're given FCD, factory converted dormitories are much smaller. You may have heard of S11, the huge dorm, but our dorms are nothing compared to those. We have dorms as small as 12 people. So right now, from 4, we are looking after about 150 FCDs, and it's about 18,000 migrant workers. And what do? We provide, now we have provided, extended our hotline counseling to migrant workers as of 1st June. Yeah. So you may have questions about language ability and all that. We are no way like HealthServe. HealthServe is doing such a great job, and HealthServe has translations and all that. We do not have that. So the workers who call in, they must be able to manage English with us. If they can't, they would have their friends to do, they put on speaker and they do translation on the spot. And and it's quite interesting. So what do we do in migrant workers? We went through what we went through with you, what I went through with you just now. We looked through the BPSS, then social concerns and risk factors. Yeah. And of course, in recent months, we will also ask them if they know of the suicide cases that were, yeah, they know, and how do they feel, what are their concerns, and what goes through their mind, and we wanted to look at protective factors, and what would stop them, why would they choose, uh, why, what keeps them going, despite the situations. And April to July, we started doing distributions to dormitory. Realized that so we didn't plan this. Along the way, we discussed and we decided we want to respond more than just going for needs assessment. So when we do this the assessment, the doctors go in, and right nowadays we go in full PPE, and then they'll write reports to MOM on the recommendations on the dormitory, and the doctors will do follow up with every dorm that they're given. And then at the same time, if there's any concerns, they will pass the contacts directly to our healthcare hotline team. We do the follow-up for counseling. And the doctors will follow up all the way. They will technically follow until the dorm is cleared, yeah, and handed over. So so we have about 300 volunteers who signed up. I don't exactly know where and how do they know about us, but people started coming. So the hotline has expanded again, this time to handle the calls, and we have to send in quickly, put together. So we thank God for multi-talented social workers who could come up with job form and really good job forms overnight. And then they sign up, then we get people volunteered to be administrators, and then they come out with database and they help us collate. So we put together 4 teams: medical team, counseling team, support team, and admin team. And that also falls during the circuit breaker time. And thankfully, because of circuit breaker, a lot of people cannot stay at home. They feel they must go out, right? They volunteered with us and they wanted to be drivers. So MOM gave us a special concession whereby if they were to show that special concession, they could drive around to help us deliver food and things to the dormitories. So we started distributing fruits, we distributed beverages and dried stuff, masks, sanitizers, yeah. And yeah. So what did we do during this time? First, I think we did it's like community mapping in the migrant workers center, migrant workers dormitories, because we wanted to know what exactly are their needs, and we started publicizing our number. And the first day that we opened the line on 1st June, we were so excited when a call came in from a migrant worker, and he said, "Hello, hello, I call." Then we were like, "Oh, is he calling because he need counseling?" He said, "I'm calling to tell you I'm well." So actually it warms our heart because we're all ready for the bleakest news, and say, "I just want to tell you I'm well. I called to find out if this line is working." Then we say, "Yeah, we're working and we're here for you." So that was a sweet thing. We realized that we don't have to be there to journey with someone when they go through a hard time. We can journey through happy times for them to share their news. They say, "I am COVID negative." And we say, "Good job. Keep yourself safe, okay?" So what the team does is we did a lot of training as a team for hotline team. Even though we're all experienced, we keep discussing issues. Every week we meet for discussion and training. And if you ask what is the most important or how do we do it, is the who very important, the where very important, where are the workers? I think the when is most important for me. Because we can have everything in place, but if we miss the time, the opportunity, if we come out with the hotline maybe in September this year, maybe the needs are not so great because people are returning back to work. Yeah. So what we do is we actually besides publicizing our line, right, we realized not many of them call us. I think they didn't know beginning they were all in-house, so they didn't call us. What we did is we pursue each one of them. We pursue them. So the doctors will give us the numbers. We talk to the migrant worker supervisors. We find out who are in the isolation ward, who are COVID positive, and as long as they are willing to give us whatever number, our counselors will follow. So we can pursue them all the way to CCF, the community care facilities. We will talk to them, we'll follow up with them weekly till they are discharged, and we'll find out what are their concerns. So different concerns arose during that whole period. And they were so glad because they said, some of them said they've never had a Singaporean who will be on the phone with them for so long, find out how they are coping. And we have social workers who, while talking to them, will be drawing the genogram to understand the family background. And the next phone call, they'll continue and ask about how's your family back home? Are they aware that you're positive? And we do have heart-wrenching stories of those who say, no, I'd rather my family not know. Yeah, because I'm the only breadwinner. I'm going to fight this. I'm going to win this. I'm going to come out stronger. But I rather they do not know I'm positive. So we walk with them. And for some who we work with them, they come out positive. They were so glad, and we rejoice with them and say, "Yeah, we're so glad you're good, you're good." Yeah. And later on, we also have those who are less who are getting anxious about returning back to work. We walk through with them, or if they have concerns that need to be raised, we raise it as and when necessary with MOM and. Yeah, so we also do like referral and intervention for not mediation, referral lah, to MOM for further advices. Yeah. So the summary of what we have done, we have needs assessment team by the medical team, we have phone counseling, and we have distribution, and the longer term work that we hope to do will be partnership with organizations to do English language lessons, which it has started in some dormitories to continue to build friendship. And we believe that this is not just a short term, a one-off, because as they build friendship with other Singaporeans or other people out of the dormitories, they're also establishing a longer term relationship, and they will not feel so isolated. Yeah. And we still have small scale distributions going on. And what we hope, if possible one day, that we'll be able to have a migrant worker service center located in the recreation centers. So if you are keen, when we set up some structures, we will also need counselor social workers on the ground in our service center to offer counseling. So this is what we came up with. We came up with a few. So this is one of the latest we came up with. Yeah. Before that, we had more wordy things. We realized probably emoticon is more appropriate because they're also used to using handphones. And yeah, when we visit them, some of them are watching all the K-drama shows. Yeah, we do fruits distribution and food, but we rarely provide cooked food distribution because the FCDs under us do not have that issue. Yeah. Because that season also crossed, we had a Hari Raya Puasa, so we decided to do a donation drive, and we also have we also use donations to buy clothes for the Muslim migrant workers and also non-Muslim migrant workers. Yeah. So this is them showing us on the first day of the Hari Raya Puasa, the new clothes that they got to wear. The lady over there is the operator, I suppose. Yeah. So this is us visiting. And Dr. Vera from the hospital came up with the idea of getting children to write cards, to draw cards during the HBL. So a few schools took up that offer. Fairfield, ACS, Pasir Ris Primary School, Anglican High School, they challenged the students to make cards for our workers, for the migrant workers, and we printed them onto PVC, and so that they could be pasted up in the dormitories. That's me, in case you do not recognize. And we also brought our counselors into the FCDs to let them understand the living situation, and that they could have a chat with the workers, and to see how the medical team interact with the workers and how they do the assessment. Yeah. So for all counselors, we also have access to all the reports written by the doctors, so that we can understand from their perspective their concerns. Yeah. So gleanings for the 5 months work, we think it's important to care for frontliners and migrant workers' psychological health. So in case we have another pandemic coming up, I think we could set up this ASAP. And frontliners also includes us, you and me, who are in this line. Because I'm also part-time at Lakeside FSC, and our caseload have gone up. I reckon that from many of my peers in this field, the mental health cases have also gone up. We also have issues with family violence cases. So I think it's important that the leaders take on this lens that we need to provide care first to our frontliners. Yeah. Symptoms of insomnia, restlessness, and feeling of hopelessness is common, and we see that in foreign workers, and also taking on a non-discriminatory practice to include migrant workers in our work. And also to practice within the competence of a social worker, because there are areas that we are not competent. We should not assume that we could do it. But we are thankful that we also have SOS to come in, that they're willing to take our referral cases if a case requires more than just a phone counseling. And we also partner with Sage Counseling Center, that they could take on face-to-face counseling too, even for healthcare workers. And we learned to manage volunteers because they came in huge number at one go. We don't have any paid staff in the organization. We're all doing this either full-time or part-time or in any capacity, or we burn our nights doing this. So we also need to learn to manage volunteers. We volunteers learning how to manage volunteers. And we learn to evolve quickly to the constantly changing situations. As you probably know, the work is changing very fast. Every week, there are new changes and new protocols. And as social workers, we feel that there's a need to respond to national crisis, because if you have read the SASW Code of Ethics, in the last sentence in the whole 5 pages, it says that social workers are committed to the welfare of, I can't see the rest of it, are committed to rise up during national crisis. That's when it's all hands on the deck, and that we put our, regardless of race, language, and religion, then when a crisis strikes, we will put out all our hearts to work together as a huge team. So moving ahead, we do hope that more organizations can look into the psychological welfare of the different players, and especially the frontliners, and especially to the frontliners in nursing home and elder care centers, and also those working amongst the migrant workers. Even the operators, the migrant workers operators are under a lot of stress, because there are new challenges every week or so. Yeah. And I know there's some social worker students here. I think for personal growth, learn and read and go and volunteer at different organizations, and appreciate every practicum, and have the can-do attitude. Whatever your soup asks you to do within your ability, just stretch yourself and learn. Yeah. So I'm thankful. And why JHU? Because it is a university with practitioners who are also researchers, and I appreciate the elements that they bring into the lectures. Yeah. Past projects we've done interim hospital in Aceh, Bangladesh. We've gone up twice to do feasibility study trips to Rohingya refugee camp. Palu, a team of us have gone up a few times, and I've also taught in the university, teaching PFA and mental health. And also the children, we started a children feeding program that's ongoing, and local projects, we do local projects with children with high medical needs. So past involvement for myself personally, I've gone up to Afghanistan, Iran, Mongolia, Myanmar, the Philippines, and Vietnam. So showing you some pictures, this is us in Indonesia after the tsunami, earthquake, and liquefaction. They had a 3-in-1 disaster. That's 2 years ago. You can Google that. Liquefaction is rarely heard of, but it is eye-opening to see what a liquefaction is. And this is the site we will see. This is my baby who went up to Iran with me when she was 4 months old. And this is my baby who has grown up, and now she goes for trips with us together with her brother. Yeah, that's all to the sharing in 30 minutes. So that's all for my sharing.
Okay, good. You all heard Bee Yong's viewpoints and comments. It's quite descriptive to an extent, but also very personal commitment and involvement in an area of work which is very new. New in the sense that very few social service agency, particularly that are involved in Singapore, involved other than Red Cross and a few others, you know. So the scope is there, the challenge is there. So maybe some of you would like to raise questions for us, for Bee Yong to discuss. Any questions you can raise?
Hi, this is Irene.
Irene, yes, good to hear you,
Hi,
Irene.
Bee Yong and I know each other when we're in undergrad days, so it's wonderful to see her. My first question, Bee Yong, how come you still look the same? And the photo that you showed with your baby, and then your baby has grown up, you still look the same too. But a more serious question, I'm involved in this movement now. I call it movement because it's really a loose group of people who want to improve digital inclusion. So we identified like working poor students who need home-based learning, elderly, and also migrant workers. So I wonder whether we could get your inputs on what would be the digital needs of migrant workers in this movement that we're doing.
Frankly, I do not know, but we can talk further. You can private message me.
Sure.
Yeah, or we can have a dialogue with migrant workers in a Zoom setting.
That's great.
Yeah, that's one thing that we also hope to do with migrant workers is there are some rooms, some dormitories where they have to reconfigure their rooms, and now they could have one room made up of different nationality. In the past, it could be same nationality, but now it's different nationality in one room because they belong to one essential service outside. They do not want to cross the different workers. So for example, if you're doing landscaping for this set of houses, you go back to the same room, but it could be different nationality. So they realize that there's some issues because of the international, different habits, different eating style, different sleeping style. So we also hope to see how we can be proactive in intervening this before it blows out of proportion, the conflicts blow out of proportion. So digital, yeah, Irene, we can talk further. Yeah, you still look the same. We used to be sweet young thing.
Yes,
Thank you.
Irene remains the same. Bee Yong
Yeah.
remains the same. Maybe
So do you, Dr. Vasoo.
I have aged, but I'm still all right. Still as youthful as many of you. But but besides that, Bee Yong, for the interest of the participants here, what do you think are the challenges, say, for a social worker like you, in working with migrant workers? What are the types of, critical kind of challenges you face, other than language, other than, time? What kind of challenges?
I think it's the setup. How do we reach them, and how do we interface with them? Because the challenge now is, if we want to run a center, we have to be as near to them as possible. Since now they are not vlogging to Little India, I think Health Serve is at Little India, right, Adrian? Oh no, Adrian is not from Health Serve. Someone is from Health Serve here. I think Stephanie, right, Steph? So so now, because there are a few recreation centers split up in Singapore, all over, if we could be as near to them so that they could come out. When they come out, we could meet them, and that's where we have an audience. We are there, and we have that natural catchment. So it's being going to where they are, rather than waiting for them to come to us. Yeah. So it's like FSC concept. We exist in the community. Yeah, I guess so. We can all think. Yeah, because moving ahead, hopefully there's some collective effort to meet them at where they are.
Mm.
Can I jump in on this discussion? It's quite exciting for me listening to Dr. Vasoo's initial introduction, where Dr. Vasoo, you mentioned that you're
Yeah.
talking to Care Corner, and then Beyond mentioning this FSC-like kind of thing for migrant workers. And in my digital inclusion group, we have also been reminded that we need to include them. So it feels like now we are, maybe as a result of COVID-19, we have now seen that social services should include migrant workers. In the past, it's like this division, only those types of certain organizations will reach out to them that is not under the main stream type of services. So to me, this is very exciting.
Mm. And I know there were some concerns about reaching out to migrant workers. Something that it might include a lot of advocacy work or human rights, But in many chit chat with the workers, it doesn't come across that way. Yeah, they face struggles like you and I do, And if not, it could have been compounded because of the lack of resources. Yeah. Mm. My phone just rang.
Is it?
It's
Well, I think
it's a
Irene,
naughty boy.
Irene, you're right. The question is how can organizations deliver services? Can they set up a special section dealing with it? Workers that are assigned to do outreach, because a lot of them cannot come out to your centers that are spread, say FSC in Amokyo or Woodlands, they cannot go there. But Woodlands, you may be able to reach out to them a bit easier. So
Yep.
you may have to have an outreach service arm
Yep.
that is able to get to know, maybe discuss with MOM, and there are dormitories that have more needs than others, and all dormitories would have a need. I think to service them will require tremendous effort. So one could begin a small pilot to see how things work out, what are the issues, what are the funding. Maybe at some point, I personally feel that MOM can fund NGOs, say organizations, to do this kind of work that would be outreach work with workers to help them
Yeah.
to work through their problem and to see how they can be enabled to become more effective and to be able to function and be a bit more settled, I think.
Yeah. Yeah.
So think about it, participants, if you are really working with some agencies, you may inspire agencies or get your agency chiefs to think about what can be done, what can our role extend or not? Can we reshape our role, reorganize ourselves? And it requires an effort and allocation of resources. Therefore, I think it is possible to do something. And maybe some agencies are more adventurous than others. Others are more conservative. But it can be done if you have an organization which is more proactive, more flexible. It can be done. So Bee Yong, right now you're on the ground. We don't have people who are dedicated to work with migrant workers. Crisis alone. But you have different types of crises, different types of ways to address this.
Yeah.
So there are a lot of organizations besides health serve. I think you need more organizations that can provide some service in that direction.
Yeah. Yeah.
Question from the participants. Anyone that want to ask? Stephanie or Galaxy Tab? Gina Go? Andrea Tan, Siva? Any question that you want to ask?
Taking attendance.
Yeah.
Tick. Ask a
Hi,
question.
hi Beyond, Julia
Hello.
here. Hi,
Yes.
actually me and my few colleagues here, we're from CGH. We're not social workers, but
Yeah.
community care workers. So just wondering,
Oh.
because I'm also a student of doing my grad year right now at SUSS with Hui Hua, I think, yeah. So anyway,
Oh.
for people who are not social workers or counselors, so do you think that we have any role to play that we can help out with the migrant workers industry?
Yes, yes.
In what ways? Yeah.
As a volunteer or as an organization?
As a volunteer, yeah.
Then you private message
from
me.
there.
We do recruitment for volunteers.
All those who want to volunteer can go to
Yeah.
Bee Yong, you know.
Yeah, I should flash my number.
Yes, yes.
Yeah. How do I flash?
You were saying that you are like also overwhelmed with the volunteer management aspect of it right now.
No, we're okay. We're okay now. We have very capable volunteer managers who oversee the front portfolio. It's amazing overnight. And we've not seen many volunteers face to face, even till today.
But I know Singaporeans are always very helpful whenever there's a crisis, so they will come
Yes.
forward. So
Yes.
that's what I believe. Yeah, you will never be short of volunteers. Yeah.
Yes. So if we were to run a migrant worker service center, we will also be hoping to get doctors in to do some simple triage and all that. And we also need non-medical people to help men. And we also hope to get social worker counselors in at the same time to do. So gradually, God willing, fund willing, with ability and people, we could start a model after FSC, but it would take a proactive role to reach out instead of expecting them to call us when they're in trouble, because sometimes culturally they don't call us or they feel, I've lived in many countries and it is nothing. Okay, Singaporeans always gather together and eat makan and all that. That's one thing for sure. But it's nothing when the locals themselves reach out to me and want to be my friend. So for that same gesture that many have given me, I think we could offer that to our migrant worker friends who work so hard for us. Yeah. Let me share a very short. Go ahead, Dr. Vasoo. Okay, when I was in Iran with my baby, and we were given we stayed in UN ground, and we were asked if we would like to go to the IDP ground. We said okay, so we went to the internally displaced people settlement, and they live in tents. So I brought my baby in. As we got off the bus, it was almost like midnight, So I had her in my sling and all that, and she was crying. And because it was the tail end of winter entering spring, so it's still quite cold, quite chilly at night. And when I went to the tent, I was like, oh, is that all I have here? Because there was only a 1-inch mattress and the whole place was filled with sand. And there was only one light bulb in the tent for maybe 4 to 6 ladies. And I was like, how is it possible? No, I was standing there wondering, And then a little boy ran to me with all bashed up kettle. And you probably could only fill the kettle for only 1/5 of the kettle because it will start leaking if you fill anymore. He said, my mom heard a baby cry. And they trailed us and they realized we are relief workers. And they said, my mom said we should give this kettle for your baby, that you can boil something warm for her. I teared, no. But then when I look at that kettle and I look at the place that I had to stay for the next 4 to 6 months, I say, I can do it. I can do this. Because you are all going through the same thing. How different is it? You go through this, I can go through this, I can do it. And that changed me. Yeah, that little boy. And then another boy came with a flat paper balloon that was not blown before. It was given by a relief worker to him, and he kept it so nicely. And then he blew it in front of my baby and said, huh? like there's language barrier, but it's beyond language by then. And he said he wanted to give to my baby a ball that somebody gave him. And in their moment of lack, there was the devastation was so huge. The death toll was so high. He ran towards us with one ball for my baby. And I said, I can do this. We are all human. We can share these difficulties together and share that space as a human. Yeah.
Very interesting episode, interesting narrative, Bee. It requires people to build up hardiness through experience and all that. So if you are wanting to learn to be hardy, join Bee Yong, a crisis alliance, that will be crisis relief alliance. So it'll be a good place to start with. Simona, you sent me a note to say that you want to know about social work, social services, Simona. So I suggest that you get in touch. I'll send you an email of Bee Yong's contact, and then you can follow up with her. She would be very interested to give you contacts and how to get by. Bee Yong, Simona is one of those who is attending your talk, so she sent me a note wanting to know about social work, social services, what are the issues. So I'll give her the phone number and then she can get in touch with you.
Yes, yes,
Yeah.
please do.
Yeah, Simona, anything that you want to say?
I just wanted to say thank you so much for this talk. I am very new to Singapore. I'm a foreigner as well, and it's good to hear from the comments that there is a movement to expand social work to migrant workers too, and that's a very beautiful thing.
Thank
So
you.
you can follow up with Bee Yong and see what the work is all about, and then you may at some point volunteer there if you want to.
Yeah.
Thank you.
Yeah.
We have counselors who are keen to do group work with the migrant workers. So yeah. We actually do not have a lot of big plans. We evolve as we go along and we hear what you can do, what we can do, and we propose it. And yeah, we're willing to grow together.
Hazel, any comments from you, Hazel? Kamran, Glendon, any comments? Any
Alert.
questions?
Dr. Vasoo used to do that in lectures. Bee Yong, last row. Comment on the policy.
Yes, Jasmina, anything from you? Yes, Muhammad, Akil, Aikil, Muhammad Aikil, are you around? He's shy to talk, He just showed me his photo only, that's all, smiling away.
Can I ask
Just
one question?
giggling.
Yeah.
I
Yes.
just want to ask because when you're dealing with migrant workers, I believe there'll be some like various cultural differences, and therefore, when you communicate, there could be certain those technical meanings and differences that you might bring the message differently. So how do you address like these cultural differences, especially when you're dealing with a few migrant workers from various different countries?
Yeah. Yeah, and in each country, they're also quite different.
Yeah,
we do what we do best as social workers with our basic skills. We ask questions. So we ask, if we understand them correctly, we ask them what they mean. Or when they say, some people group tend to say they have heart pain. So we had to clarify, because it's probably not heart attack, but so we have to clarify whether it's really heart attack, heart pain, and many times they mean they are worried. It's heartache, when you hear of somebody committing suicide. So we keep asking, when we ask them what would they do if they're back home for the same situation, what would the father do, what would the mom do, for us to understand the contextual, the context they're coming from. Yeah, so it's a learning experience. And for all my counselors, social workers, we all agree that this is the first time ever in our whole life that we have spent so much time talking to a migrant worker. We see them downstairs at the HDB block. We see them cutting the grass. Sometimes we say hi, sometimes we just walk past them. But we have never once had a conversation of a reasonable length with them. And it's really, really interesting. Yeah, I think both sides. I think for them, it's interesting for them to hear from us too, that we show interest in their life, in their family, in their concerns. Yeah.
Thank you. Was language an issue for you in a sense?
Yeah, sometimes, yeah. But my husband says after about 10 minutes into the phone call, sometimes I speak a little bit like them. So I think we just evolved. Probably they speak a little bit more like us. And for the first few weeks when we started answering the phone calls, was a bit hard to understand. We find it very hard to understand them. But I think gradually we get used to it. And now I don't hear that from the counselors. Yeah. Initially, some were quite discouraged. Say, half the time I don't understand, they repeat. But after a while, it gradually it's not too bad. It's not too bad. Yeah, we just got to change the language, and yeah, and they also learn to speak to us. They are probably as puzzled why they couldn't understand us. No, so I think we're not the only ones struggling in the conversation.
But it definitely takes time, lah. Takes time.
Yeah, and we do WhatsApp with them too. We find that sometimes it helps relay some information. Yeah, but they probably ask their friends, no, and then they answer for me, for the friends.
Right. Okay. Thank you very much.
Yeah,
Thank
Christopher,
you.
yeah, you're right. The whole issue is how to communicate. And I know that there are quite a lot of students who are Hindi speaking, who are Bangladesh speaking, who are Tamil speaking in the university environment, you know. So if you can mobilize them, they can do the translation for you, you know, through the phone. And
if they
there are
are
a lot of them.
keen,
Yeah.
they can talk to me because we want to come out with little comic strip.
Yeah.
In the vernacular languages. Yeah.
Yes.
I see.
So
about depression, anxiety, and we want to come up with our own indigenized comic strip.
Yes. We mobilize, I help mobilize quite a group of students from under Dr. Leong Ching, who is the Dean of Student. So they offered, because in the hostel and all the university environment, postgraduate, there are a lot of students, resources around. So the question is how to tap them, how to engage them, and they are all very helpful. They're willing to help. And one could get them, you know, to be able to translate and then to do comics and do write-ups and to do brochures that in a language that they can appreciate and understand. So there are these resources. So we need to see how we can mobilize them. And University OSA, Student Affairs Office, you know, Office of Student Affairs, would have the resources there. So all you need to do is to get hold of Leong Ching, Professor Leong Ching, and she would provide you the volunteers that if we required beyond.
Oh, great.
And she can always get students who are good in graphic, in social media, in animation, to produce the stuff that you think will be helpful to your workers.
Oh, nice.
Yeah. I should be happy to get you connected with her anyway. Yeah.
Thank you, Dr. Vasoo.
Hi, Bee Yong.
Hey, Ming
Can
Ching.
you hear me? This is Ming.
Yeah.
I have actually I work with a group of international scouts in Singapore. So they are also a good source of resources to tap on, because part of the scouting spirit is service to community. So I'm actually the service coordinator who coordinates some service projects for them, and for them to reach certain rank, which is quite equivalent to what we call Singapore's President Scouts. They do have to produce a project. So I'm constantly looking for this kind of opportunity. I I will get in touch with you to see how we can help in this with CRA.
Oh, that's great. That's
Yeah.
great. Right
Like
to
what
me.
Dr. Vasoo says, it can be in animation or it can be building something that they need in the dormitory.
Yes.
All this can be done. Yeah.
Yes.
So I will get in touch with you. I will WhatsApp you.
Yeah.
Yes. Yes.
Yeah.
I thought maybe we can even come up with comics on conflict resolution. Like a series and something really cute, about them quarreling over something, but it's actually it's a non-issue at the end of the day. It's because of the wrong use of words or something. And then you have good laugh, but actually we can all live together. It's not so hard after all.
Yeah. So I'll get in touch with you and see how, where the areas that, we can actually tap on these resources as well.
Yeah. We
Thank
don't
you.
have a reasonable website, so sorry, but we're Facebook, so it's crisis
Okay,
relief line.
anything works. They say if you can deal with it, we all can deal with it, right?
Yeah, if
Whatever.
they can build a website, that's even good, better.
We'll see how we can go. Yeah,
Yeah.
from here. Yeah. Thank you
Yeah,
so
you
much.
can initiate.
Meng.
Meng Chin, you can initiate.
Yeah, sure.
Surely you have quite a number of them who want to do interesting projects. So encourage some innovation, some thoughts, and how to implement this helping process out in the field for people who may need it. You see, so it's a good thing. So Bee Yong, so you have a resource. You can tap them and then get them to do some exciting work there with the workers.
Yes.
Mr. Teram, are you able to bring up anything for discussion? Venga is silent, Venga is silent. Susan, anything? No, Susan. Susan Lau. Xavier Tan, anything or not? They like to bring up Xavier? Adrian, no, yeah, Adrian, of all the person, Migrant Workers Center, Adrian. You're in the forefront, yes, Adrian. Any question, Adrian?
They're doing such great work.
Yeah.
NWC.
NWC, yes.
Yeah, hello, hi.
Yes.
Yeah, just now I actually texted Bee Yong. So just to highlight that, we have a lot of workers calling us, and they do show like signs that they require counseling, but unfortunately we are not trained counselors. So the thing that we specialize in is in the employment laws. So we can advise them based on employment laws and work with them and MOM on how to facilitate their issue. But end of the day, some of them do call us and say, I feel like so down, so depressed. Some even do say that they want to commit suicide. So sometimes it's tough for our team as well to handle this because we're not trained for all that.
Yeah.
So can collaborate, Adrian can collaborate with them. And maybe it'd be good if we can tie up with some counseling agencies as a collaborative partnership where such cases could be referred, Adrian? And I'm sure that Care Corner, Feye, some of the family service centers nearer your dormitory where these workers are staying, they could be referred. And the agencies probably can be inspired or encouraged to see whether they have a service that is available. So that can be explored, Adrian. So you may get into a loop and then you may be tied up with all these legal thing, and then an employment issue, accident, other related stuff, claims to be made, non-payment of salaries, retrenchment, they got to leave their job places. So there are a lot of, other than the legal and other process, there are a lot of other issues of personal and stress and conflict sort of issues. And this can be tied up in partnership. If you have such a thing, let me know. I can always ask some of the family service agencies to think about looking into how they can work in partnership with you people, as a joint service,
Yes, that'd be great. But I think ultimately also the language is another issue lah.
Yeah.
Because sometimes although the counselors they know what to say, but they can't say it because the worker doesn't understand it
Yeah.
due to language mismatch.
So you have people most of them would be probably, your dormitory workers will be Bangladeshis and Tamil speaking people, right?
Yes. We also have
So,
others like Telugu and all that. Some of them when they call. So yeah.
Yeah, if they're Telugu and all that, they should be able to understand Tamil to some extent. Some of them may not, but we have workers who speak Telugu. We have workers that social workers and others, or volunteers that are involved in counseling that speaks Tamil and Telugu and Sinhalese or whatever it is, if they are from Sri Lanka. So some of them, I think most of yours will be Bangladeshis and this Hindi, or they speak Bangla. So they need, some people who would be proficient in those areas.
Yeah, we actually have Bengali speakers.
Yeah.
So I mean the three main ones, Mandarin, Bengali, Tamil. We have staff who can speak all these languages, but I think it's just more on the other aspect where trying to reach out to them and counseling them and all that. Because our main focus is actually to assist them with their employment related issues. So and especially now a lot of them want to resign and want to go back, and a lot of them actually are feeling very frustrated and some even more angry because it takes so much effort for them to go back, and they don't understand why is it so difficult for them to go back. But there's so many things that's happening in the background. They might be under quarantine, the employer might not want to buy the air ticket. There's so many other things that factor in, and it changes how they feel. And sometimes I think for us as MWC staff, we are not in a way trained to handle or to reply back in the correct manner in some
your workers and all that are caught in between,
Yeah,
between
correct.
legal, between policy. So you are a mediator. So
and sometimes we do have to deliver bad news to them, saying that unfortunately because you are on quarantine order, you cannot leave.
Yeah.
So we have to tell them the bad news.
Then they get angry with you, and then they get angry with all others. You see.
Yeah, our staff have also shared because sometimes we need to refer cases over to MOM. So when the worker sends their details over, they send additional things over. Example like photos of the parents in the home country, like in the deathbed. And our staff just gets so drained because of all these, because I mean we are here to settle their employment issues, their repatriation, all the kind of thing, working with MOM. But these are all additional things that I think our staff also need to have a bit more information on how to handle all these things.
So you have to tell Yo God Kwang to employ a few more counselors to work with your center, and migrant worker center.
That will be for me to tell, but
I will have to tell him that, I say, how come, I won't say it came from Adrian. I say, I understand, that there are these things and there are these.
Yes, please, you can say you receive feedback, but
I
don't quote
receive
my
feedback.
name.
Yeah, I won't quote your name, No problem. I got nothing to lose. I can tell them, look, hey, this is service you people can provide,
Thank you so much.
Yeah. No problem. Yes. It doesn't cost me much anyway to say something. Yeah.
I think also one thing to highlight, because we are actually running one of the recreation centers, and currently there is a system put in place where workers, if they want to move out of the dormitory and if they are cleared, assuming everything is approved, they can actually come to our recreation center, which is in the Sunni area. So that is one of the catchment sites. And beyond, if let's say you're
where is it?
Sunni Road near Pioneer MRT.
Penjuru, is that?
Pioneer MRT.
Pioneer
Road.
MRT.
Yeah. So if you want to reach out to us and speak to our management with regards to reaching out to workers, that could be one particular spot, because we are one
So
of
you
the
provide
few.
housing?
No, currently, no, not housing. It's a recreation center, so they can actually go there to like do their grocery shopping. We have
Yeah.
services for them as well, which is
Mm.
we have partnership with POSB and Singtel over there. So they actually have satellite stations being set up over there
Yeah.
for the workers to go. So this is just started very recently. So we hope that it will pick up and more workers will be able to come out. And if let's say you want to speak to our management in terms of like using the space to reach out to workers, that could be one of the areas, because currently, if I'm not wrong, we are one of the few recreation centers that have been approved to have this kind of system where the workers can
Yeah.
come out to us. Yeah.
Yeah. I visited a few, but which one? What's the name of your recreation center?
Migrant Workers Center Recreation Club.
Ah,
Yeah. It's
it's
at
hard. Is
Soon
it
Lee Road.
staff? Oh, Sunday. Okay. Is it staff all the time? Every day
Uh,
or just weekend?
Um, basically it's every day lah. Yeah, it's open every day, but
Oh.
in terms of staff being there currently due to COVID and all that, there's also other things where our staff are not there all the time. We're trying to do as many things as we can remotely as well. So a lot of us are working from home, but we do take
Actually,
turns to go down. Yep.
we need a lot of funding to
Funding,
place
that one I
workers,
think Dr. Vasu
the
can talk
staff
to
workers.
Mr. Yo also, see what they can do. That one not for me to comment as well.
The Vasu.
Yes, what is it? Funding for what? Workers.
For migrant worker service centers
Ah,
in recreation centers run by
oh,
NGOs or whatever, but funding.
oh.
Yeah.
This Mike, you
Because
mean
these
you
places are more remote away from residential housing.
ah
Usually they're amongst factories and more remote places. So it's also hard to get workers to willing to go to such remote places.
I see. So we can always persuade our NTUC Migrant Workers Center to see whether they can work in partnership with you people, because they have the funding, or they can persuade MOM to give the funding. MOM should provide some funding to NGOs. You think so? For promoting recreation activity, to promoting follow-up, for services that you provide, you need a place, you need a center for them to go together, to come together. And there's a cost to it, maintaining and running such a center. That requires funding, right, Beyond?
Yes, definitely.
So
Definitely.
Crisis Alliance want to go into running these sort of centers.
We are keen to explore this possibility, working
Yeah,
like a FSC concept, but
ah,
in the recreation centers.
I see.
Yeah.
Then you can start off with migrant workers. So all ready made.
Yeah.
You can have a place, you can start, and then, or you
Yeah.
can persuade migrant worker center to see whether they can work in partnership with you people. So there will be a joint effort to tackle a problem. It meets their objective and also meets your objective too. Yeah, that
Yeah.
they would have the resources, I think, uh, because it's a large base. And I'm sure Adrian would not want to openly say that, but I know that they would have funding, and they can always persuade MOM to give the funding for such things that would be required. I think we should be able to, if you can put up a paper, or what you can do, what voluntary organizations can do, NGOs can do, or what you think can be helpful. If you have such a paper, send it to me, send your proposals to me. I will be too happy to forward them to sources where uh, they might have to decide, whether it's a project worthwhile supporting or not. Temasek Care, for example, they do fund, they give food to workers, they give millions of dollars, I mean, they can consider giving funding to projects that are worthwhile helping workers and all that. So for participants, if you have any worthwhile projects you think can help migrant workers, or you want to initiate a pilot project, let me know. Send me a small 1-page, 2-page project proposal, with what your funding cost is. I think bottom line is they look at your funding cost. Then what do you provide? Say a 2-page, very simple, readable, persuasive enough. Let me know. I will be happy to act as a we call general postmaster. More than a postmaster, I can be an advocate, to get such projects off the ground. Anyway, so any other question that you all want to bring up? Gina, go. Samina, Nas, Andrea Tan, anything to bring up? It is a challenging task, because we are in a country, in a society where population is changing, population profile is changing, and you need to find new people to come in, new people to do things. So we can't avoid having to have people coming into a place like ours. We cannot be a closed society. We are going to be open in due course, and if you are going to be in due course open, and then to be able to allow people to come and work and be part of us, then we have to look at different ways to try and engage them and support them and be able to be a bit more, I would say, more inclusive. I think that is very important. We need to be, ecologically, we are all binded together, whether you like it or not. So there is a need to be open enough to think of ways, since we need to tap people, talents and workers and others to do work in places where people don't want to work, and we can't get labor to go in, and you can't do without them, you need them. And many countries it's the case. You go Europe, you go to America, you go to different places, except developing countries, that has surplus labor. In places where there are lack of labor and growing, reducing labor, manpower, then the need will be there to engage them and to involve them and to recruit them and to have them. And we are going to, if we are going to continue to have them, to have these people to help us in our economy, in our community, and to help the society to grow and to be able to move and make progress, then we must find ways to try and see what we can do to help enable them to be inclusive. And we have to find different ways. It's challenging, and it is part of work with people, interesting kind of work with migrants and with people who are different from different parts of the world coming in. And Singapore being a multiracial place, a global place, you can't escape from this arena, which will comprise of people with different persuasions coming in, and organizations that we are engaged with, whether it's NGO or government organizations or semi-government organizations, statutory organizations. We have to think proactively, I would say, how to be proactive to be able to see how we can work together to deliver services that will enable people to become better, and to try and see how we can reduce human misery, human needs, and human problems. And if we are set up for that purpose, the main objective is to make life better, then it is up to us. It is our responsibility as people to find different creative ways, different meaningful ways that we can enable someone who is in need to become better. And if we can do all that, then the place will be a better place, more humane place, more sensible place, a more livable place for all of us. So thank you for coming to this seminar. We'll have more of this coming. So I'd like to thank all the participants, Julia B and all this, Meng Chin, all of you, Venga and all that, joining us in this. Let us give Bee Yong a big hand, although she may not be able to listen. So let me thank her for that. And we wish her all the
Thank you.
best. Bee Yong, thank you very much.
Thank you. Thank you,
Okay.
Dr. Vasoo.
So
Thank you.
we'll close the session, Bee Yong. So thank you for coming, and on our behalf here, we'd like to thank you for sharing your views, and we hope you'll be able to recruit more people to join you in your cause, Crisis Relief Alliance, CRA. Okay, thank you. See
Thank
you all.
you.
Bye.
Bye-bye.
Bye.